Two. What's going on, folks? Your boy again, Dr. Sean Thomas, back in the building with the Be More Today show. We are back, and we are still in the month of October, celebrating PT Appreciation Month, a great month for us PTs to come together and to remind ourselves that we are kind of amazing. We do great things to help our communities and to help the world feel better and to get back to the life that they love. And that's been the focus of our shows for this whole month, bringing on dynamic people in the world of PT who are doing extraordinary things for you and me in our communities. And that's all on the Be More Today show, which again, as you guys know, in our 4th season now, Be More Today show has grown and continues to be a movement. BeMoreToday.com has everything you need for my book, our swag store, our more merch, the running coaching I'm doing, all on BeMoreToday.com. So go out there and check out the site. And of course, you can find these shows on our Be More Today YouTube page and on Spotify and on Apple Podcasts. So if you want to hear any of the shows we've already done, go on Apple Podcasts, go on Spotify, go on Be More Today on YouTube, and follow those shows. You will not be disappointed. The show now has grown to 80 countries. Again, heard 80 countries and over 53,000 downloads. So again, thanks to your love and support, this show continues to grow, and it's all because you are trying to be more today. So I appreciate you. And our quote for today is simple as always. You don't just wake up and become the butterfly. Growth is a process. Now, if you are a PT like me, you already know one of the hardest things I think that we see is people coming into our clinics, into our spaces, into sports arenas, gyms, facilities, fields, and expecting to be great off the bat, expecting to go out there and to run that race perfectly, expecting to go out there and to hit the ball off the bat well, coming after a surgery. And growth takes time. It's a process. And that's one of the hardest things I think about being a PT is showing someone how to get through the process, showing them that the growth that they're going through is part of the journey. And everyone wants to get to the finish line. They want to have the medal. They want to have the accolades. They want to have the trophies. And those are great, but it does take work. And the process, I think, is something that a lot of us try to escape or try to really get through. But that's really where all of the growth comes from. Your ability to be resilient, your ability to go there and recognize and see how strong you really are when the days are hard, when the exercises are too tough, and you're going through these motions, right? Whether you're training for a big race or just trying to get back to the life that you really love, it's that process that we all have to go through to be better. And you appreciate the ability to move as a result of that. So just remember that growth is really a process. You don't just wake up and become a butterfly, right? There are stages to this thing. And my guest on today's show is someone who has helped many people go through those same stages of growth, whether they're on the field or trying just to get back to their regular life that they love every day, 24 hours, 7 days a week. He has done a great job helping people to get back to the life that they love. And his name is Jess Barsotti. Now, Jess is a licensed physical therapist and the associate director of the JAG Physical Therapy Ocean City, as well as a certified athletic trainer. Jess was born and raised in Vinland, New Jersey, and attended St. Augustine Prep, where he wrestled and played football and earned numerous student-athlete accolades. He moved to Boston to receive his bachelor's degree in athletic training from Boston University in 2006, and went on to receive a doctorate degree in physical therapy from Boston University in 2008. Now, during his clinical rotations, he had the opportunity to work with the Indiana Pacers, the BU Terrier ice hockey team, and the MIT Engineer football team. Jess also assists as a medical volunteer for the Boston Athletic Association's 2005 and 06 Boston Marathons. Jess worked as a physical therapist in Boston, as well as serving as head athletic trainer at Arlington High School. And now Jess has treated a wide variety of sports and orthopedic conditions and has developed new treatment techniques for plantar fasciitis and sciatica, two big topics we're going to talk about tonight. A member of the APTA, American Physical Therapy Association, just presented his research on plantar fasciitis to the APTA of Massachusetts in 2015. Jess worked as clinical director of 2 PT facilities in Boston, while also completing a 2-year fellowship certification in the American Academy of Orthopedic Manual Physical Therapists in 2016, and now mentors future fellows for the American Academy of Manual Therapy. Jess moved to Linwood, New Jersey, with his family in 2019 and spends most of his free time at the beach in Ocean City. Jess is dedicated to improving the standard of care in physical therapy and is an active clinical instructor regularly accepting clinical students from Thomas Jefferson University, Stockholm University, Rowan University, Boston University, Northeastern University, and MGH's Institute of Health Professions to help educate future physical therapists. He has experience working with all types of patient populations, including but not limited to sports-related injuries, pediatrics, and post-surgical cases, as well as neurological conditions such as Parkinson's and MS, concussions, and TBIs as well. Jess became certified in dry needling in Jersey in November of 2022, and now offers dry needling as an adjunct treatment to all appropriate patients. Ladies and gentlemen, boys and girls, pets included, please welcome to the stage my fourth guest for the Be More Today show for this month, our month, Jess Barsotti. Jess, what is going on?
Sean, that intro was incredible. What would it take to get you to say that every time I walk into the clinic, just every day of the week? You just announce that when I walk in. That would just make my whole day, I think.
I'm going to record myself saying this. I'm going to send it to your OM.
That would be
And
fantastic.
have
Just
it
my own
playing in the
little hype
background.
speech right before I walk in. That'd be great.
Or you
Man, this is
can,
impressive. It's 9 o'clock our time, and you're still going strong. This is great.
yes,
You've worked
sir.
all
Yes,
day. Yeah,
sir. I got to
that's
find some
impressive.
theme music for this, though. That's what I need. Get a little theme music to it, too. And then I think we're all good to go.
Right? Exactly.
Jess, listen, I haven't met you in person, but I really love your vibe over this call right now. And reading your bio, I see that you and I share a lot of things in common as former athletes. I was an athlete at Brown University. I ran track there for 4 years. I was captain for 2. I won Ivies twice, and whatever else. And a lot of the things that I use in terms of my PT mantra, my PT thoughts, and just my the way that I treat my patients, right, is really based on what I was as an athlete and what I continue to be as an athlete now as I do marathons and whatever else. So I'm curious for you, as someone who's been an athlete and continues to work with athletes as an AT and also as a PT, how much of what you've been through as an athlete really has defined what you are now as a clinician?
So I always treat patients the way I would want to be treated. And, you know, working with athletes, being an athlete myself, like I want to be challenged. If an exercise isn't challenging enough, I think like, why am I doing this? This feels like a waste of time. And I can see that on some of, sometimes my patients' faces, definitely on other PTs, patients' faces, when they're doing an exercise that just doesn't fit with what they got to do. If you're doing something like playing a contact sport, football, hockey, if you're going to be banging up against somebody else's, full body weight, using a TheraBand, using a 2-pound dumbbell and doing a little bit of external rotation, that's not going to cut it. I mean, yeah, we'll start there early on after an injury, but if we don't quickly move away from that after a few weeks, we're doing that athlete a disservice. And I think you're going to see it in their face for sure if you're paying attention.
Yeah. Yeah, I agree. I think the benefit of being an athlete and now being in this realm where you have access to athletes but also to people who are not athletes is that you see both perspectives. Like exactly what, for the most part, what everyone's feeling. When people come in and they say, "Oh, you don't know what this feels like," I'm like, actually, I know exactly what this feels like because I for my meniscus when I did this or that, I was doing the same thing. So it's a great perspective being able to see and explain to people, yeah, I kind of can feel what you're feeling because I have been there. It's not going to be the same, but I can empathize with you when it comes to your treatment. I can actually understand where you're coming from. And though our experiences are different, my experience is different than yours. I know what it takes to put that work in to get to where I want to be. And I want to show that for you also. So I think it's great having that perspective. And for you, being someone who's an AT and a PT, you have that dual membership that I say where you can be it's so diverse in treating so many different populations. So and then your research, as I've already seen from your bio,
all right, we got it.
yeah, you've done a lot when it comes to sciatica. Now, I know that it's a very common term. You know that as well. I
Yep.
think everyone and their mom is always, "Oh, I got sciatica. I got that sciatica again. It's coming up." And
Yep.
sometimes it is, and sometimes it's not. But I'm curious. Maybe you can help the listeners understand what sciatica really is and how they can differentiate it from any other back pain that they may have. Because sciatica is something that everyone kind of talks about. And you and I know sometimes it is and sometimes it's not.
Absolutely. So sciatica is at its simplest just inflammation of the sciatic nerve. And that nerve is a big bundle of nerves that just run down the sides and back of your leg. And I think what we really need to convey to everybody is that sciatica is just a symptom of an underlying problem. Now, that problem might be in the lower back, it might be in the hip, it might be in just what you're doing day in and day out. I treated a judge a while back who, just sits in a courtroom all day. I said, "Can you get up at all?" He's like, "No, if I stand up, everybody in the courtroom's got to stand up. I got to stay sitting for most of my day." And he's got this, flaming sciatic nerve that, I don't think anything was structurally wrong with his back or his hip. He's just sitting on his nerve all day long. Other people might have something structurally wrong with their back. A disc is pushing into the nerve. Maybe the bones are starting to slip apart like a spondylolisthesis, or maybe they just got some tight muscles around that nerve that are squeezing it. So that's part of the issue, I think, with the general population is if you Google what to do for sciatica, you'll find a long list of things, and some of them seem contradictory. You can't do it all and feel better. So I've seen a lot of patients who tried something online that was just making them feel worse. And I asked them, like, "Why are you doing this?" And they said, "Well, I did my research. It seemed like the right thing to do, but it's making them hurt worse." And I say, just stop for like a day or two and just watch how much better you'll feel.
Yeah.
So yeah, really need to do our homework. Look at, okay, yeah, you got this nerve inflammation, but why is that happening? What's underneath that nerve that's causing this to go wonky? And once we figure that out, we can make a big change to their pain as much as we can with their environment, their work activity, whatever it might be.
Right. Yeah. Yeah. Now, I know you said you've done some research on this and you found techniques that were new in terms of treating people with sciatica. What are some of those things that you can share with either the PTs who are listening or with some of the people who are actually struggling with sciatica still?
Yeah, sure. So I mean, some of them aren't new. Some of them are just, really obscure. So the issue of neural tension always bothered me because when you look at it in research, neural tension is this idea that your nerves get stretched. And they don't like to be stretched. You stretch a nerve, it gets numb, it gets tingly, it can start to hurt after a little while. But the problem is that it doesn't correlate with the structural damage. So some people could have a really big herniated disc, for example. They might have terrible structural damage in their back and they got no neural tension. Other people, the opposite, they got nothing wrong with their structure. And for whatever reason, they put their hamstring up, they try and tie their shoe, and their whole nerve lights up like crazy. Why that is, we don't still know yet fully, but it bothered the heck out of me. So I looked into it, and there's a bunch of neural mobilization techniques out there. You might have heard of nerve glides. And that foundation of research comes out of, if you read Explain Pain by David Butler and Laura Moore Mosley, David Butler did a lot of independent work on nerve glides and how to move the nervous system and what to do. And we like to think of the nerves as being fixated. One nerve comes out from one level in the spine, it goes to this spot, but the nerves really can move a lot. They can slide up or down a couple millimeters, sometimes a couple centimeters, sometimes, and they're supposed to do that when we move. And that's the crazy thing is that if you touch a nerve, you can get an electricity zap. But we take it for granted when we move in all these complex patterns that we don't feel that zap. Why doesn't that happen all the time? Because this nerve is so sensitive. It should zap all the time. Just like you're playing that game Operation, you hit the wrong piece, it's going to zap on you.
Right.
But somehow we can move in all these complex patterns, and our nerves are fine because they can move with us most of the time. Once in a while, though, they can get stuck. And where they get stuck can be very remote from the spot. So David Butler did some studies where he found that some stiffness in the neck can actually cause some sciatica down low because it just restricts the whole movement of the spinal cord. So if you've got somebody with sciatica, start paying attention to, hey, does your leg feel worse if you just, turn your head side to side? If you just look up, look down. Sometimes you might move your arm a certain way and you feel a zing down your leg. That's all clues as to where your nerve might be caught and what's causing that neural tension to happen. And again, that, figuring out the true cause, you got to look at somebody really in depth sometimes and figure it out. And you need to have that therapeutic alliance, and they need to work with you and keep sometimes like a detailed activity journal of what all they did in a given day and when it hurt and when it didn't hurt.
Mm-hmm. Yeah.
It's complex, it's challenging, but I mean that's what keeps this job interesting. I mean, I'm 15 years in. I have worked with a lot of people. I was trying to do the math. It's probably about 3,000 some patients at this point.
Yeah.
Athletes, non-athletes, you name it. It's a lot of people, and for something like sciatica, there's at least 50 different causes that could light it up.
Yeah. Yeah. I think the funny thing about sciatica is that everyone thinks they have it. And I think
Oh yeah.
I don't know why that's like the main back pathology. People just oh yeah, it's my sciatica is acting up again. I'm like, is it though? Like, what exactly is happening? Talk to me so I know what's going on. And 9 times out of 10, it's usually not. But then that one time it really is. But everyone assumes that they have it. So I think, like you're saying, just being able to know what exactly is going on and then knowing what to do. I mean, the nerve glides are great. A lot of people are doing clearly the, smash and roll, or the a number of different things just to work on nerve tension and being able to glide that thing out. But I think a lot of people just don't know. And what we see that's on other shows on YouTube and on other things, sometimes they're helpful. But again, we're here to really make sure that as you're looking at those things, we can differentiate, what's for show and what's actually going to be able to help you in the long run. So
Oh yeah. Yeah, all the right stuff is on YouTube. It's just a matter of figuring out, what's going to work for you and what's not going to work for you. And to do that, somebody's got to take a look at it.
yeah, yeah, absolutely, absolutely. I know for me, it's been marathon season. This whole beginning of fall, as I did Berlin actually last month, and we have NYC coming up next month. And a number of the runners that I work with, and as you probably have seen as well during this time, have, as they continue to put in lots of miles, miles and miles, foot issues pop up. And plantar fasciitis is another thing that people continue to say, "Oh, I have plantar fasciitis," and sometimes they absolutely do, and sometimes they absolutely don't. So, as someone who just, again, looking at your bio and what you've done, a lot of research talking about plantar fasciitis, I wanted to know if you could, for listeners, just kind of give us a basic synopsis of what that again is, and ways that runners or anyone who may be struggling with plantar fasciitis can work on preventing it, mitigating it, etc. Because for those who do have it, it is something that can linger on for a long time and can be very, very
Oh yeah.
painful and irritating. So, what are your thoughts on plantar fasciitis in this treatment?
So this is a long topic for me. So I'm giving this talk actually this weekend to the podiatry convention that's happening in Atlantic City. They asked for a PT's take on what to do for foot pain, and I'm presenting this information. And that talk's only going to be about a half hour, but the full talk I gave in Massachusetts was about 90 minutes. So it's a detailed, in-depth thing, and a lot of it comes down to the fact that when we see plantar fasciitis, oftentimes that's an umbrella term for a lot of different problems in the foot. Now, whether that happened initially or they compensated as they went along, they started hurting other things because they're limping around, they start moving their foot differently. It's hard to know for sure sometimes. All right, what was the primary injury and what's secondary to it? But I tried to tease out as much as I can. Okay, the plantar fascia is there, yeah, but if you have pain in your foot, it could also be the muscles underneath, some of the joints underneath. So going with the pattern of movement. And, PTs have started to do this a lot with back pain, shoulder pain, neck pain. We're looking at how people move and then classifying people based on those categories. So if somebody comes in with a diagnosis of plantar fasciitis, yeah, like you said, they might actually have it, they might not. I want to take a look at them and see, okay, does it hurt more when you're up on your toes or more when you're rocking back on your heel? Because those two, could be both the plantar fascia. Plantar fascia can get sensitive to both of those. Mm-hmm. But how you move and what hurts there defines our whole treatment paradigm. And we need to, split it off. If we don't, we're going to do a mess of things that'll make the problem probably worse. Or, like you said, just let it linger and not let it heal up. So sometimes the flexors of the toes get in the way. Sometimes that quadratus plantae muscle, it's called, abductor hallucis. These are all some of your toe muscles that are working every step you take, every time your foot hits the ground. And we take them for granted. A lot of PTs, they don't even go into this in PT school. Or if they do, the foot is like, the last week of orthopedics of the lower extremity. They just condense it down. They expect you to learn everything about the foot in like 2 lectures. Right. And there's no way that PTs could possibly be experts on a foot, for 2 hour and a half lectures maybe. Mm-hmm. So I dive into this pretty in depth, and then I also explore, okay, what are the exercises you should be doing? What's the footwear you should be wearing? If you have pain, for example, when you go up on your toes, a softer shoe, a shoe that allows your toes to bend more, is actually going to make that pain worse. If you can take your shoe and you can roll it up into a ball, that's not going to help your pain. But if your pain is when you rock back on your heel, you want that softer, more cushioned sole. You want to get as much cushioning under your heel as you can. Alternatively, some podiatrists especially give out this orthotic that helps with the arch support. Now that can be helpful for some of the arch pains, but if you got that heel pain and it's got a stiff plastic cup under the heel, that might just be making you worse too. And it's unfortunate I have to tell patients that, because oftentimes they've spent, at least $100 or more, especially if it's a custom-made orthotic. It might be hundreds of dollars that they spend on these orthotics. And I got to tell them, listen, just try walking without it, see if it doesn't feel better. And sure enough, usually it does. And they're a little upset that they spent the money. Right. And changing up the environment too. So, I'm working in Ocean City now. I've seen a lot of feet. I didn't set out to be a foot expert, but between working in Boston Marathon going on, and then there's all these cobblestone streets that people are walking around in fancy shoes because they want to be fashionable. People hurt their foot a lot in Boston. And then now I'm in Ocean City, where we're a beach town, so everybody shows up in their flip flops, wants to
Mhm.
walk barefoot all over town, walk the boardwalk, hurt their feet like crazy. So I've gotten really good at feet the last 15 years. uh, but uh, but looking at how a person's foot fits into their shoe is important too. So shoes come in different sizes, and now fortunately they come in different widths. For a long time, shoe widths were always one proportion to the length of the shoe, and that was terrible for me. I got what my mom called sturdy feet. I need like a double extra wide shoe, because a regular narrow shoe like a Nike, my foot was always just falling over the edge of the sole. It was terrible. So fortunately, now they make double wide shoes, but even then, a lot of people's feet don't fit the shoe quite right. Their
Mhm.
feet are a little too wide in the front, a little too narrow in the heel. Maybe their foot's sliding around a little bit. If your foot's sliding around your shoe, you're going to either consciously or subconsciously be clawing at the bottom of the shoe with your toes, and your toe muscles are going to get lit up. And that inflammation there can cause that plantar fascia to get really taut and tight. And then you step down on it first thing in the morning, it hurts like hell. So I recommend everybody really who feels these foot problems, walkers and runners especially, to look up how to change the lace patterns of their shoe to fit their shoe better. So there's all kinds of ways you can change the laces. That standard X that we got, you got to question that and think, who set this up? This wasn't by a PT. This wasn't by a podiatrist. No foot expert made these laces happen. That's just how we've always done it. So people think, oh, that's got to be right.
Mhm.
But for any foot problem, hammer toes, bunions, especially plantar fasciitis, changing how the foot actually sits in the shoe with these lace patterns can help a lot. Now, I can't take credit for this research. I got this from a lot of the recreational outfitter stores like LL Bean up north. And I think that all just was passed down wisdom from, Appalachian through hikers or on the Pacific Crest Trail, dealing with these hiking boots that they needed to fit just right to walk, 2,000 miles or so.
Right. Right.
And they passed it down, generation, but now it's all on the internet. So you can just Google how to change the laces to make your shoe fit better. And doing something like that can help a lot with all kinds of foot pains, but especially plantar fasciitis.
Interesting. I have never even thought about changing my lace pattern on any
I
of the
know
worn.
it's so simple, and honestly, it saved a couple patients from like a hammer toe surgery, a bunion surgery, because they're like, "Oh, my foot hurts in my shoe," and I'm like, "Well, just change how you tie it there, so it's got a little bit more room to breathe, and
Hmm.
then the pain's gone. Like
Hmm.
then they feel fine. They don't need a
Yeah.
surgery, and
Yeah. Yeah.
it's so cheap and simple."
Right. Absolutely. That's great. I mean, again, you've had experience working with so many people with foot issues, and yes, I know the cobblestone streets in Boston, as I've done that half a couple of
They're
times.
dangerous, yeah.
Yeah, it's a little, little dangerous. But I think your experience in being able to see those diverse populations has helped your ability to see people's feet in different lenses and be able to give some good counsel for that. And I'm curious, besides the laces, a lot of people go to what they always say, oh well, I took an ice thing and I rolled my foot on the little ice thing, and that's not really helping. And that seems to be what I don't even know how this happened, but that seems to be the go-to exercise that everyone who has plantar fasciitis does. Oh yeah, I'm rolling my foot on this frozen bottle of ice this frozen ice bottle I put in the freezer last night. I'm not sure who started this as our like main method of treatment, but for
I mean,
whatever
it was in
reason, that's
Runner's
the
World
go-to.
magazine every month for like 10 years at least.
Right.
Yeah.
So people are still doing that. So, I just wanted you, if you don't mind, just to either support, defend, negate, some of those techniques as people are still trying to rehab themselves of
Yeah.
this thing. Is
Yeah.
that
Yeah.
a good thing they should be doing, or is it kind of antiquated?
It is not harmful. It's got a chance of working. Like I said, plantar fasciitis is a big umbrella term. If your particular problem is one of those muscles under the bottom of the foot, rolling on an ice, just like rolling on a foam roller using a Theragun, that's going to help a lot. If your problem is standard plantar fasciitis or some of those bones or joints, it's not going to help much at all. You can still do it if it makes you feel better psychologically. I say go ahead. But there's a lot of research out there now questioning whether we should call plantar fasciitis an itis or actually like an osis, because when they look for any inflammation, they can't actually find it. So
Hmm.
having like a cold roller probably doesn't help much at all for the plantar fascia, because it doesn't ever seem to really get inflamed. Now it can get thicker. There was just a study that came out a few years ago where they were using some Graston tools, some instrument assisted soft tissue, and they found that after like 8 visits of that, they could make the plantar fascia get back to its original thickness, which was cool. And it was in runners, and they went from I think they had a 40 on the LEFS, and they got back to 80 at an
Wow.
80. 6 out of 10 to 0 to 10 with walking and running.
Mhm.
So definitely, working on the bottom of the foot does have value. If you've ever had like the Graston technique or any of the instrument assisted tools, though, they hurt a lot. Like that's a lot more pain than you can inflict on yourself with an ice roller. So I also suspect that some people using the ice roller aren't pushing hard enough on it.
Mhm.
And that roller might just be too soft, might not be small enough to get into all those little muscles in the foot where it needs to get into.
Right.
And that's, if that is the case, they just got to push a little harder, maybe, suck it up and grind away on that foot.
Yeah, those are all good thoughts. I think having someone who has that same mindset is helpful, especially for the runners who are going out there trying to do NYC in the next couple of weeks. And as an athlete or a former athlete, as you and I were, you want to pursue everything to get to where you want to be. And
Yeah.
sometimes these lingering issues, although they're not, too debilitating, they can definitely hinder and make your races and your other competitions a little more challenging. So being able to mitigate that in any way is going to be a great thing to do.
Yeah. Oh, and fortunately for you, it's didn't sound too debilitating, but there I've had some cases where people have been depressed by it, they gained a lot of weight. We can turn their whole life around just by taking away this. Like sometimes it feels like they describe a knife in their foot feeling.
Right,
Walking around on that is pretty terrible. And
right.
yeah, again, it might not be a big deal to some patients, but it could be life changing for others.
Absolutely. What are your thoughts? I don't know if you have any experience talking about like different shoes, like rocker bottom shoes versus some of the New Balance shoes they have out there, which have a wider um, a toe base or toe box. What are your thoughts on like the shoes that people are wearing nowadays and the ones that are advertised as better for certain things like plantar fasciitis and other things? Are you for those? Are you against those? What are your thoughts?
I would say first have somebody look at you, and then yeah, maybe those shoes can help a lot. Now the rocker bottoms and a lot of research I saw didn't help all that much. Some people do like them, like it does change your mechanics for sure. But again, you may or may not like that. I would always test trial these things, or at least make sure that if you're buying it online, you got a good return policy so you can send it back if you don't like it. But a lot of the higher end running stores, I'm sure you got them in New York and Philly. They were out around Boston. They have some trained staff who will look at you walk, they'll look at you run, they'll put you in the shoe, they'll put you on the pavement or a treadmill and say, okay, take a little walk, take a little jog. Let's see how this looks, how it feels, because it might feel okay to you at first, but that's just like buying like a couch or a mattress too. It might
Mhm.
feel fine at first, and they spend a few hours in it. It's like, no, this isn't that good. And that's the problem with a lot of cushioning that we find in the soles of shoes. If it's too cushioned at first, anything that's too soft at first won't last that long. So if
Right.
you're going to go a long distance, you might not want too cushioned of a sole unless you've got like a really good mechanic and you just need a little extra padding under it. If you, on the other hand, need more support, if you need more of a dense type shoe, then you got to stay away from some of those air soles, the cushioned ones, anything that says like, so it's got the memory foam in it. That's probably not the way to go if you need a little bit more support. But just that idea of like supportive footwear, like that gets tossed around too. And to some people, that seems to mean as cushioned of a shoe as I can get. Other people, that means like a stiff sole, clog boot that I can find.
Hmm. Hmm. Yeah, no, very true, very true. I think it's just funny how all these different terms kind of come up when you're talking about footwear, because everybody's foot is different. But I do think you knowing what your shoe size, what your foot style is, whether you pronate, supinate, flat foot, etc., knowing what your foot is like. Because even for me, there are certain shoes that I know that I can definitely wear, and those shoes I wear all the time. And there's certain shoes that I want to try, like the Hokas I want to try and the new ones. But I just know for me, if I know that my Nike, my Pegasus, those things work for me, I stick to those. Even when I did the marathon this past September, I had the option to try a new shoe versus a shoe that I had that I worn before, but it was kind of worn. And I say, you know what? I'm sticking with Old Reliable because I've worn shoes that I wanted to try for a race, and those did not ever pan out well because how they felt on the treadmill or how they felt when I was walking around on the track felt totally different during the race. So what you're saying is spot on. Trying those things out, seeing what's really going on, and then really testing them out. And if it doesn't feel right, it won't feel right in the long run. Take that
Right.
back and return it. Take
Well, and the other issue is that shoe companies can change things up on you too. Like when they come up with a new model of shoe, they can
Yep.
change the materials. It can be a whole different feel. New Balance did that to me like 10 years ago. I had this great pair of New Balances. I loved it, felt great. The next year they put out this new model. I can't remember. It was like the 950 to the 951 or something.
Yep.
And it felt terrible. I had so many foot problems.
Yep.
Yeah, it was awful.
Yeah.
And again, maybe they saved some money on the materials. Maybe they thought it was better through some of their research. Who knows? But didn't work for me.
Yeah, completely agree with that. I had the same exact experience. So for whatever reason, yes, stick to reliable because shoes do change like clockwork. Um, Jess, I know you are someone who defines yourself as a manual therapist, and you've certified manual therapy. You've done a number of different things. And speaking to a lot of our new clinicians, and I say new as in like maybe PT's out for the last like 5 years, or even less than that, right? Many of them have kind of strayed away from manual techniques as the primary choice for them to use when they see certain patients who have certain pathologies. I'm talking about the typical ones that, in terms of school, you and I may have learned that those are things that require therapy, like manual therapy, right? Whether it's like replacements for knees or rotator cuff repairs or what have you. But even in terms of like itises and OCCs, right? We sometimes will do MREs and manual resistance exercises for those patients as well, scapular mobilizations, whatever we're going to do, just to work on some kind of manual, some kind of tactile something for these patients. But a number of our new clinicians and even some seasoned ones have kind of strayed away from the manual concepts that you and I grew up with and have been learning for the last number of years. I wanted to get your thoughts on what you think when it comes to the deviation that PTs now in this day and age are doing in terms of focusing more on movement, more on observations, more on therapeutic exercises, and less on manual techniques to help our patients feel better. Are you for this? Are you against this? What are your thoughts on this?
Overall, I'm still on the fence myself. I like all my manual skills. Looking back at my own success, I am not sure I would have had the same level of success if I didn't do my manual skills, but I don't blame any PT for not wanting to do them. It can be tough on our bodies. Like, personally, at the end of the day, I can be a little bit tired and sore sometimes if I wasn't watching my own body mechanics. Our standard treatment table, it's a wooden plinth. It's a height that's not cut for my height for sure. Maybe some PTs like that height doing some manual stuff. I don't. We have one high-low table, mechanical table in our clinic that goes up and down. And that makes a world of difference for me and how I feel at the end of the day, at the end of the week for having done these skills. I know some PTs who have been working, 10 plus years and they've shied away from it because their hands are starting to hurt too much. Their body's starting to feel like they got wear and tear, and they feel like, they can't give the same level of care that they want to. They feel like they want to, continue to preserve their career, still be able to work, not go on disability just for doing these skills. And I don't blame any PT for making that choice. The other issue is that with insurance, coding, reimbursement, manual therapy pays the least of a lot of what we do. So exercise pays better, neuromuscular rehab, therapy activity, they all pay better. Minute for minute, we're getting paid less to work on somebody with our hands. So you might be getting implicit or even explicit guidance from your, top of your company all the way down to your clinical director saying, listen, don't do manual therapy. It's not paying as well. Do these other skills. Get your patient exercising. And again, the climate's tough. I know inflation's tough. If your company wants to stay alive, I don't blame anybody for saying, hey, let's, shy away from this and get, focused on making profitable stuff so we can pay our staff. That makes perfect sense to me too. The other issue is in research. When research looks at the effectiveness of manual therapy, if they look at the long-term outcomes, 8 weeks out, a couple months out, 1 year out, there's no difference oftentimes between whether somebody got manual therapy or didn't get manual therapy. At the end point, they feel about the same. Now, the road to that recovery, you and I both know, can be a lot different. And I tell a lot of PTs this, any PT who's a little reluctant, manual therapy is best, I think, at relieving pain in the short term. I can do that well. I can get things moving quickly. I can restore movement patterns quickly and get patients on a right track. Patients are very grateful for that, both because they see some immediate progress and it's a reduction in pain.
Mm-hmm.
Take an example that, a lot of adults are familiar with. If you have a headache and I tell you, okay, I can give you this exercise, I'll take your headache away in a month, or I can take it away right now. A lot of people are going to say, well, let's take the pain away now and maybe show me that exercise too. And that's what all my patients end up saying. They're like, yeah, let's get rid of the pain now if we can, and then also show me the exercises to help prevent it, to correct it, keep it from coming back. But looking at all those downsides of manual therapy, it's like, why would anybody do manual therapy? Like, it doesn't have a lot of payoff on the outset, the long-term end. But like I said, I think overall my success has been greatly enhanced by working hands-on with people. A lot of patients are very grateful for it. I think my diagnostic skill, my ability to get to a sense of what's happening with somebody, is very much enhanced by feeling how their muscle, how their joint changes over time. If I observe that, I can pick it up now. Early on in my career, I could see somebody move, and I wasn't nearly as good at seeing, like an altered scapular pattern or a little bit of a hitch in their stride with their gait. Now I can see that, but that took a good, 2-3 years of watching people. We did it in practice in school. We'd watch, video of somebody moving, and the professor would say, "Did you see that?" We'd all be like, "Yeah, sure, we saw that." I'm like, no, I didn't see anything. You see what she's talking about? So, and at this point, I think I've worked with like maybe 25 different clinical students from all different schools, and some schools, they're doing a lot of manual therapy. Some schools aren't doing a lot of manual therapy. The end result can be the same. It's just a matter of, what's your patient want? What do you want? How does it feel for you? How does it feel for their body?
Yeah.
You put all those things together and it works great. I have some patients who say, listen, this manual therapy you're doing, like these Graston tools, they hurt way too much. Even like the joint mobs, they hurt too much. They don't want to go that route. They say, let's just do it the slow, less painful way. And I say, sure, that's fine. It's your body. Whatever you want to do.
Yeah. Yeah. And that's good. I mean, I think having the dialogue with patients is probably the best way to handle it. Cause I know some people definitely come in on all they want is manual. All they want is, look, I don't want to do anything.
But it is a passive treatment and they can get dependent on it. Yeah, definitely.
Exactly. Just give them the manual so I can get out of here. But yeah, if you have a patient who is actually invested in what's going on, I'm not saying that those who want manual are not invested, but I think like you said, once they understand that, yes, may get your pain now, and then we can't do this forever. That's come a point in time where we're going to show you things so you can get better in the long run without our manual hands to help you do that. And when they can buy into that thought process and that mantra, yes, then they can get better with exercise moving forward. So I think the manual techniques are great. And, I wish that we had access, especially in New York, to things like dry needling, because again, we can't do that here in New York, but in Jersey, you guys can do that. So for some who are still trying to figure out what that is, we talked about acupuncture on the show a number of times, but dry needling, because we can't do it in New York, what do we talk about? So can you share with the listeners what dry needling really is and how that can also be helpful to mitigate someone's musculoskeletal pain?
Yeah, absolutely. So dry needling actually uses the same size needles as acupuncture, but the underlying theory, the rationale, where we're sticking the needles is completely different. If I remember right from the research I've looked at, there's maybe 351 acupuncture points, versus there's over 600 muscles in the body. So I'm sticking dry needling mostly into restricted muscles that need to get moving, either in a better pattern. They might be tonic, might be cramped up, might have some scar tissue. For whatever reason, and we still don't actually know why muscles respond the way they do to these needles. This started back in the 50s, I think it was, when cortisone had been invented, I think in 1938, maybe 1939, right, about a decade before that. And they were sticking cortisone in everything. Cortisone was like a magic bullet, get rid of inflammation. Now, the story might be made up, might be apocryphal at this point, but the story goes that at some point, somebody forgot to put cortisone into the needle, and they stuck the needle into somebody, and the person still felt better. And they're like, all right, well, maybe that's just a placebo effect. Mm-hmm. But when they started to study it, the needles had a stronger effect than just the average placebo would. So they started to look closer in, and they started to use like electron microscopes to see, you could see the head of the needle. And these needles, they're tiny. If you've never seen them, they're about 5 times smaller in diameter than the needles used to give injections or draw blood. So literally, you can't feel something going in. Like people ask all the time, does it hurt? And I say, sometimes, yeah, it feels like a mosquito bite. Other times, I was amazed. Sticking some needles into the muscles of my face for like a TMJ or a headache type thing, I literally didn't feel the needle at all. And it was crazy because it's my face. It should be well innervated. Why didn't I feel this needle going in? Right. Versus needles in my hand or my foot. Oh man, they were the worst. Yeah. I've done needles for plantar fasciitis and it works great, but man, some of those hurt a lot. But at any rate, you stick this needle into a muscle, and the muscle seems to clench onto the needle a little bit. Now you can enhance that effect by some acupuncturists and some people doing dry needling. PTs can do it, chiropractors, doctors. A lot of states will allow people to dry needle as long as they go through all the classes and the courses. You take this needle and you can go in and out with it in like a pistoning technique, they'll call it. Or some will, start to fan it side to side so they can cover a wider area. But the best effective technique seems to be put the needle in and then you twist it. Now, if you wind a needle like 3 or 4 times like this, what's really wild is that you can't pull the needle out. Like the muscle grabs onto it so tight that you'll see like the skin come up with the needle and it won't come out until that muscle relaxes, which can take, 10 to 15 minutes sometimes. So at JAG, we're doing like a 30-minute treatment. That too varies. I've seen in the research, some PTs are doing just 5 or 10 minutes. And I wonder why. Same thing happens with manual therapy. Like, when people choose to set a time on their treatments, I'm always questioning, like, why did they choose that time?
Mm.
I think in school we learned like 90 seconds for a stretch is enough, 90 seconds for a joint move is enough. Yeah, that's fine on a 20-year-old kid. If you got somebody 40 plus with arthritis, 90 seconds is not going to cut it. You're going to need more intensive treatments.
Right.
But that may be why some PTs abandon manual therapies, because they tried it on somebody for only 90 seconds. Well, this 40-year-old's still stiff. It didn't work. So let's try something else. Versus like, well, no, just try it for a little longer and stronger and see what happens. If I do one bicep curl, my bicep doesn't grow. That doesn't mean bicep curls don't work. That just means I didn't do it enough.
Right.
So with needling too, I think the dosage is important, and they study the dosage as the number of needles, how long you leave the needles in for, how much you twist them up. After about 15 minutes, most people are getting some effect, but about 30 minutes, which I think is why JAG picked 30 minutes. About 30 minutes, everybody feels a good effect, and it takes about 3 or 4 visits usually to get the muscle to really loosen up. But what's still crazy to me, it bothers me a little bit because, like I said, I'm proud of my manual therapy skills. The needles seem to work about 4 or 5 times faster than any massage I can do, whether it's me working in my hands, grass and tools, and I don't know why. I stick a needle in, I twist it up, the muscle clenches and then it relaxes. And, if I compared like a half-hour massage, yeah, it's going to take 4 or 5 times the amount of a massage doing that same effect. So I have some TMJ that, my jaw will click and crack sometimes. I stick a needle in this jaw. The hell was last summer, I think, last July, and it hasn't clicked and cracked since then. Meanwhile, like anytime I was eating, nachos or a cheeseburger, I'd have to like rub my jaw like this after a few minutes because it would start to hurt. Now I can eat all that stuff, no problem, no clicking, no pain, and it was one needle for like 10 minutes. I had it in there. It wasn't even a full length, and I don't know why it worked so well. Like we still don't yet understand the underlying physiology. We just see this muscle grabbing onto this needle and then relaxing. And for whatever reason, that lasts a long time and it works well. But yeah, why? Again, yeah, it's crazy.
Yeah. But I mean, I think that's the beauty of our profession. There are so many tools that we have in our tool shed that, if Grafton works, then great. If the Hypervolt is what they need, then that's great. If our manual techniques work, then that's great. And if not, then we have dry needling, we have acupuncture. There's so many other things we can really just pull from and to get the same results. So I think what we have in our profession, especially because we're now the musculoskeletal specialists, we have so many tools we can help people get better. And
I was really excited about dry needling because like there are muscles all over the body where we can't touch them all that well with our hands. Like if I'm trying to get like the subscap under the the scapula because somebody can't externally rotate enough, they're limited there. Like I can grab it a little bit, but not much. But I can get a needle in there and go all the way in, twist it up, and that thing will stay loose for a while. And it's incredible, and it allows me to treat basically every muscle in the body, even muscles I previously couldn't touch or had to push like really hard into somebody's body. Like trying to work on the psoas, forget it. That was always awful with using somebody's fingers, but a needle sticking right in close to the back. It's easy and overall a lot less painful, believe it or not.
Absolutely. That's one of my first memories actually when I was running at Brown my freshman year. I went to a massage therapist because I had back pain. And he's like, oh, well, let me just try this thing. I'm gonna put my hands on your abdomen. I'm like, well, I said I have back pain. why are you putting your hands on my stomach? And he did this psoas release, which I didn't know at the time what was happening.
Oh, sure.
I was just so amazed. I was like, how are you reaching my back through my stomach? What's happening? But when you learn it in school, like, oh, he was doing a psoas release. That makes sense to me. But yeah, just all those things that, again, if you're not in that world of thinking about the body and anatomy and physiology, seeing something like that just blows your mind because you see how intricate the body really is. And I think as clinicians during this month, our PT month, it's just amazing to see how we can really, even though the body is so amazing and it has so many things that we still don't even know, we have a pretty good knack or a pretty good understanding of how to fix most things when it comes to musculoskeletal system. And I think it's just a beautiful thing that we can actually get people better and get them back to the life that they love. So it's great. It's great.
Yeah, I think so too.
Jess, I have two more questions for you. And the one is one that I've asked every single person on the show. It's about what Be More Say means to them. And as a former slash current athlete, and because I say that because once an athlete, always an athlete for you, Be More Today is a mantra that we use for a number of things, but it can be applied to everyone when it comes to either their work stuff or to their growth when it comes to PT or even their athletic careers and athletic pursuits. So when you hear the phrase "be more today," Jess, what does that phrase really mean to you?
Man, that's a lot. It makes me think of a lot of things, but yeah, growing as a person for sure is, I think, the number one thing. Like I remember, hearing that business adage, you're either growing or you're dying, and I do think that applies to people a lot too. Like we're either growing and getting better, or we're stagnating, and maybe we're not going backwards, but other people are moving forward around us. The world's moving forward around us, and it's tough to keep up. Like things are changing really fast, so you got to struggle sometimes to keep up. But yeah, if you aren't continually growing, everything else is going to leave you behind, and you'll find yourself outdated at some point, and just wondering what happened, saying inappropriate things because times moved on, and you didn't pay attention to the changes. So
Right.
yeah, we got to keep up.
Yeah, we gotta keep up for sure. Listen, just anything you want to share with listeners, with aspiring PT students, or even current clinicians during our physical therapy month. Any thoughts you want to share with people who are listening right now?
Oh man, I think the number one thing that I feel myself struggling with at this point is getting complacent. It's a constant struggle to not stop thinking and constantly questioning things. I don't know if you ever read the book Thinking Fast and Slow, but at a certain point you can put a lot of PT on autopilot. Like you've seen enough hamstring strains, enough back pain to be like, all right, I got a long list of exercises. I'm just going to rattle them off, no
Yeah.
problem. But the person in front of you might be completely different for any number of reasons. And you'll be doing your thing and they'll say, this exercise hurts a little bit, or that didn't feel as good as I thought it would. And I got to say, why? Why did that happen? Why didn't that work? And that's how a lot of that plantar fascia stuff came about, because I would do something, some people would say, hey, man, that feels great. And I would say, all right, cool. I'm going to do that with the next plantar fascia person. And then it wouldn't work. I was like, what the heck happened? Like I did the same thing as plantar fascia. Why didn't it work?
Right.
And constantly questioning, like, yeah, what about this person was different than that person? You wouldn't give a baseball player and a soccer player the same therapeutic exercises. At least I hope you wouldn't at the end of the stage of the rehab. Maybe early on if they got the same injury, but
Mhm.
after a few weeks, it should diverge pretty quickly. But if we get in this cookie cutter, like, it's back pain, just give them all this, give them all that, it's easy to fall into that trap, and I feel that pressure myself constantly. I like having clinical students because it's fresh eyes, it's fresh people coming in and questioning, like, hey, why'd you do that? And I got to think, yeah, why did I do that? Is that still a good idea? It might not actually be a good idea anymore. If you don't have somebody around you to question it, you got to question it yourselves. But yeah, it's always good to kind of dust off everything and think, do I still know this? Do I still think what I think I know? If not, why not? Did I change my beliefs at some point in the past? That answer your question? That was a lot.
Absolutely. No, absolutely. And I feel the same way. I feel like it's almost impossible to not fall into that trap, especially when you see in
Oh
the
yeah.
same diagnoses sometimes, right? And it's like you said, autopilot. You walk in, you know exactly what you're gonna give somebody because you know it works. And sometimes you're on it, like it works like clockwork, and there's no even a thought process of mine because you're so confident in what you're doing. My wife actually one day, she's like, "How do you know that what you're giving someone is gonna help them?" She's an attorney, so she has, there's no like connection to help anything. So she's always like, "Oh, how do you know that what you're giving someone is actually gonna help them out? Like, what do you?" And then I'm like, yeah, well, because this is how the body works. If you do this, this will happen. Well, how do you know that? I'm like, because I've seen it happen 1,000 times. That's how I know, right? And I've just seen it work for 1,000 people. But like you said, maybe it's that one person where it doesn't work for them. And what do you do? And for me, I'm not gonna lie to you, Jess. There's sometimes when that happens, and I get offended. Like I get like,
How
what do you mean
so?
it's not working? Like
Yeah,
what do you mean that hurts? That's not supposed to hurt. You're not doing it right. And I blame the patient at first. But in all actuality, it might just be that it's not working for them because there's something, like you said, something else is going on, or maybe their postural alignment's off, or maybe there's an underlying issue that's happening that I haven't even looked at yet. So I do think that even though we can become very, very into our regular routines, we, like you said, we can't get defensive, and we have to be open-minded to say, maybe this is not going to work for this person. How can I do it differently? And yes, students definitely help that because they bring the new research, they bring the new thoughts, they question everything. And what has been autopilot for us can very quickly be like, oh, well, you know what? I don't know why. I've been doing this for like 10 years. I don't know. I just do it because I do it. But what's the
right.
rationale behind it? So yeah, I think those things also just are great for us to be able to keep a spark up when it comes to our PT practices. So let's keep doing it.
Absolutely.
Let's keep doing it. Jess, I appreciate you being on this show, man. You made this one for the books, and I just want to say happy PT month to you. And I wish you the best for all your endeavors. And I hope to see you sometime in person, either before the year is out or sometime next year.
Hey, you're welcome in Ocean City anytime, man.
Yeah, I got to come and hang out with you on the beach.
Absolutely.
We can definitely do that. So thank you so much.
You're welcome, Sean. Take care. Have a good night.
Yeah, you too. And folks, listen, he said so many poignant things, right? And I quote from today, because kind of going in line with what he was talking about, you don't just wake up and become the butterfly. Growth is a process. So all those people who are out there, either as patients or your clinicians out there, this thing is a process. PT is a process, and you got to put the work into it. You will see results, but you got to put the work into it. And yes, there are a number of ways that we can get you better, whether it's manual techniques in the beginning or exercise at the end or vice versa, or all together. You will see improvements, but you have to trust the process and just be persistent. And you too can see that growth being a process for you if you don't give up. So listen to what Jess talked about, so many poignant things. Know what's happening with your body, do the research, check out sciatica and plantar fasciitis, see how your body's really working, and make sure that what you're doing is in line with what's actually happening for you. And if you have any questions, please go see a PT in your area. We are the musculoskeletal professionals when it comes to this thing. This is what we do. So check us out, of course, at JAG PT if you're looking for a PT in your area. And if not, you can always find somebody else. But JAG PT is the big provider for tri-state area, and we'll be here until the wheels fall off. We're doing great things in this part of the neck of the vineyard. So, folks, as I always say, have a good day, have a good night, have a great life, and continue to take your steps to greatness to be the best version of you. We will see you next week. And again, happy PT month. Peace.